Today we will discuss about the anatomy of the cubital fossa. So what is the location of cubital fossa? Where is the location of the cubital fossa in our body? So this is elbow joint. In front of the elbow, this triangular region is known as cubital fossa. If we talk about the definition of the cubital fossa, so cubital fossa is a triangular hollow space situated in front of the elbow. So what is the significance of the knowledge of the cubital fossa? So we can use collect the blood sample and giving the intravenous injection in this region, and we can measure blood pressure also in this region. That's why the knowledge of anatomy of the cubital fossa is very important. So in this lecture we will discuss about the definition and features, content and boundaries of the cubital fossa, and also the clinical aspect of the cubital fossa. So in this diagram, this is the humerus bone, this is lateral epicondyle, this is medial epicondyle, this is radius bone, and this is the ulna bone. So if we talk about definition, so definition of the cubital fossa is a triangular hollow space situated in front of the elbow. Now we will talk about the boundaries of the cubital fossa. So it has an apex, base and two wall, lateral and medial wall, a roof and a floor. So now we will see the structures of the cubital fossa. So from this lateral supracondylar ridge, origin of the brachioradialis muscle. From here, origin of the brachioradialis muscle. This is brachioradialis muscle. Now, from the medial epicondyle, origin of pronator teres muscle. This is pronator teres muscle. Origin of pronator teres muscle. So this is brachioradialis muscle. And this one is pronator teres muscle. Teres muscle. Now, if we draw an imaginary line from the medial epicondyle to lateral epicondyle, this imaginary line demarcate the cubital fossa. So this triangular region is known as cubital fossa. So if we talk about the boundaries of the cubital fossa, so it has an apex, a base and two wall, lateral wall and medial wall. So base of the cubital fossa is formed by an imaginary line which is drawn from the medial epicondyle up to the lateral epicondyle. The lateral wall of the cubital fossa is formed by the medial border of the brachioradialis muscle, and medial wall of the cubital fossa is formed by the lateral border of the pronator teres muscle, and apex of the cubital fossa is formed by the meeting point of the lateral border and medial border of the pronator teres and brachioradialis muscle. Now we will talk about the roof of the cubital fossa. The roof of the cubital fossa is formed by the skin, superficial fascia containing median cubital vein, and lateral and medial cutaneous nerve of forearm. Now we will draw the diagram of the roof of the cubital fossa. This is the elbow region. This is the skin of the elbow region. If we remove the skin, we can see the roof of the, we can see the superficial fascia in which the, here is the location of cephalic vein, basalic vein, and interconnecting vein is known as median cubital vein. So this is cephalic vein, this is basalic vein, and this is median cubital vein. Now, this is lateral cutaneous nerve of forearm. Sorry, this is median cutaneous nerve of forearm, and this one is lateral cutaneous nerve of forearm. This is lateral cutaneous nerve of forearm, and this one is medial cutaneous nerve of forearm. So if we talk about the contents of the cubital fossa, the content of, if we talk about the roof of the cubital fossa is formed by the skin, superficial fascia containing median cubital vein, lateral and median cutaneous nerve of forearm. Now we will talk about the floor of the cubital fossa. The floor of the cubital fossa is formed by two muscles, the brachialis and brachioradialis. Now we will draw the diagram. This is humerus, lateral epicondyle, medial epicondyle. This is head of radius. This is ulna. Now here is the location of supinator muscle, and this is the location of insertion of brachialis muscle. This is brachialis muscle. This is brachialis muscle, and this is supinator. So if we talk about the floor of the cubital fossa, so floor of the cubital fossa is formed by the brachialis muscle and supinator muscle. Now we will talk about the contents of the cubital fossa. Now we will draw another diagram for the contents of the cubital fossa. So this is elbow region. This is humerus, medial and lateral epicondyle. Okay. Now this is imaginary line draw from the lateral to medial epicondyle. region of brachioradialis muscle. This is brachioradialis muscle, and here is the origin of pronator teres muscle. And this region is known as cubital fossa. Now we will talk about the content of the cubital fossa. From median to lateral, if we go from the median to lateral, so here is the location of median nerve. This is median nerve. I have not a different color for the nerve and vein and artery, so I will draw only blue from the blue color. This is median nerve. Now here is the location of bicep brachii muscle, and this is the tendon of bicep brachii, which is inserted on the posterior surface of the radial tuberosity. I will draw, this is median nerve. In between the median nerve and tendon of bicep brachii, here is the artery present known as brachial artery. This is brachial artery. This is brachial artery. This is tendon of bicep brachii. And finally, here is another nerve known as superficial branch of radial nerve, which is located on the laterally. Superficial branch of radial nerve. So these all are the content of the cubital fossa. If we go from medial to lateral, this is median nerve, brachial artery, tendon of bicep brachii muscle, and superficial branch of radial nerve. We can remember these all contents by a simple mnemonics MBBS. M for median nerve, B for brachial artery, B for tendon of bicep brachii, and superficial branch of radial nerve. So this is all about the cubital fossa, anatomy of the cubital fossa. Now, what is the clinical significance of the cubital fossa? In the region of cubital fossa, in the roof of the cubital fossa, we know that here is a vein which connects the cephalic vein to the basilic vein known as the median cubital vein. So if we give a blood sample, or if we receive an intravenous injection, so we can use the median cubital vein for the purpose of giving of intravenous injection and for the collection of blood sample. Another clinical significance of this region is the pulsation. We can use the pulsation of brachial artery during measure blood pressure. So we can use measure blood pressure in the cubital region via the brachial artery. That's why the knowledge of the anatomy of the cubital fossa is very important. So this is all about the cubital fossa. So this is all about the cubital fossa. Thank you.